Today we're speaking with Dr. Matt Cook. He is a doctor of regenerative and integrative medicine. His company, BioReset Medical, is doing really interesting and very forward-thinking treatments for people who are suffering from anything from chronic pain to depression to anti-aging. Really fascinating conversation, so welcome to the show. Thank you, Dr. Cook, for joining me today.
Oh, thank you. I'm so delighted to be here.
Well, I'm excited to speak with you about so many things, but I always start the conversation off with the question, what do you believe?
So it's interesting. We started, and I was just testing some things out on you of like what I was thinking about. But then at the end, what I said is it's going to be amazing because that's actually what I believe. I believe that it's going to be amazing.
Yes.
I believe that the human spirit is strong, and it's interesting. We're going through all these difficult things, but I think that if we connect to our strength and we connect to our purpose and our mission, what happens is amazing things happen that are often unpredictable, and often in the moment we don't anticipate that it's going to be amazing. But if we keep focused on that possibility, it generally seems like that's what happens. So that's what I believe.
I love that. I agree with you. There's so much about that flow when you know that you're connected with your purpose and your higher purpose and your true purpose, that everything sort of falls into place, doesn't it?
Yeah. It's interesting it's interesting. We were talking about this yesterday. If something, and I'm going to move my computer that is propped up on top of a tambourine closer to me.
We're going to play music later. Yeah.
So I'm so excited about that. It's interesting if something bad happens to you, but somebody did it to you, but it was totally a mistake. You could just shake it off almost like nothing happened. But by the same token, if something bad happened, but you perceived that there were sort of nefarious reasons that they did it, it's hard to overcome that happened to you. And so the context that we take things in is actually like super important. And interestingly, if our mission is strong enough, if our mission that, it's like in my case, I just feel like we're supposed to do something amazing together, like on this planet as people. So that's maybe my mission. But is then if you're in the middle of doing something amazing and something bad happens to you, it's easier to take because you're just thinking, well, I have a mission of changing the world.
Yes.
And so if that's your mission, then little things kind of bounce off you a little bit like Teflon.
Yes. That's true. Well, because that's a true passion. It's a passion for what you're doing. And I'm curious, what made you decide to do what you do? And for people who are listening, you are a doctor and you are a holistic doctor, but you work in alternative medicines. And can you explain exactly what that means, what integrative medicine is and all that you do? Because it's fascinating and I can't wait we're going to do a deep dive on it. But just maybe explain to the audience what that is.
Yeah, so I like to tell people that I come from the heart of the medical industrial complex because I was trained as an anesthesiologist at UCSF in San Francisco. And so I was doing anesthesia to keep people asleep for liver transplant surgeries and heart surgeries. And I spent my career doing nerve blocks to basically every nerve in the body, and which was super interesting and fascinating, and was a lot of high-tech science and a lot of sort of physiology that were harnessing to essentially keep people pain-free and asleep during surgeries. the entire time I was doing this, I was looking for sort of a human connection. And so I started studying integrative medicine 20 years ago. And so I ended up getting a doctorate of medical qigong and got board certified in functional and integrative medicine. And and that process was beginning to try to understand physiology and physiological processes,
Mm,
just like I had on the Western side, but from a variety of different perspectives. And so on the energy medicine side, there's sort of a physiology of how energy flows in the body.
yes.
It tends to map very similarly to kinetic chains and a lot of the work that comes from exercise physiology. So there's a huge overlap of Chinese medicine and yoga and kinetic chains and functional movement.
Mm,
So we were deep in that. And all the time I was trying to figure out how to reset muscles and kinetic chains and meridians, I
mm,
was doing nerve blocks. And so then what happened is I started finding out that you could do regenerative things around nerves. So, for example, we've used things like 5% dextrose, regenerative things like stem cells.
mm,
And now I use something called peptide therapy. And
mm,
so I put peptides around nerves and to reset them. And and so I'm using an integrative strategy. I'm using everything from as far afield as acupuncture and everything as techy as ultrasound guided placement of drugs around nerves to reset and heal them. And then in the same way, we're doing the same thing on an immunology and wellness front. So we're taking a look at organ systems in the body,
mhm,
seeing how they interact with each other physiologically,
mm,
and trying to tune and harmonize how they work together. And part of that is by doing a little bit of a deep dive into what's actually going on. So is one number too high? Is one number too low? Doing screening for things like cancer and trying to have a holistic, comprehensive approach,
mm,
and then using a suite of therapies that range from peptides to hormones to supplements to different IV therapies. I spent my whole life putting IVs in people. Uh,
mm.
Basically give them propofol and put them to sleep. That was like the
Right.
Michael Jackson drug. And
Yes.
now I'm doing things basically to physiologically turn the brain on and kind of reset things and wake people up.
Wow. So what is the most effective way to do that? What have you found in your practice?
It's interesting. That's a totally fantastic question. And the I would say the most effective way to do it is to understand what someone's problem is. And so every person I'm sitting and kind of talking to them. And so uh, what would be the most effective thing for you might be different for someone else based on your genetics or your
Mm,
lifestyle or culture. So for the most part, what I'm trying to do is to do a deep dive in terms of figuring things out, but then have a whole bunch of fairly standard protocols that people can begin to engage in.
mm,
So then we can try. And so I may not get it right the first time, but it's an evolution, and I'm being kind of thoughtful and careful, and then doing my very best to try to help you be super involved and participating.
mm.
Because typically what happens is once you're really involved, then your health is your mission statement.
Yes.
And
Yes.
then once that becomes your, and it's interesting, even like with COVID, I've been telling people my health, my health had been basically kind of fantastic, and I didn't need to try that hard
Right.
to be super healthy. And so I was trying like a 8 or 9 out of 10. But then ever since COVID, I've been trying like a 10 out of 10 because I feel like I gotta go for it.
Well, I feel like you were the person to ask what to do during COVID for sure, and how you've been able to maintain your health and what we could all do to sort of, I mean, clearly there's so many, I mean, there's so many questions I have, I don't even know where to begin. But yes, but with COVID, I think it's super important we touch on that subject.
Oh, so with COVID, it's interesting. I've talked to a couple hundred people about this. One thing I did is hilarious. Uh, my friend Barb quarantined with me, and we opened a bottle of wine every day for the first 2 weeks of COVID.
Right.
And I had never really thought I'm drinking too much, but that first 2 weeks was like, whoa. So then basically I stopped drinking for the rest of COVID. And
Right.
I basically had one, I had like a glass of wine once, like 3 times during COVID. And that was kind of amazing. It like felt super good and kind of reset that whole thing. And so I made a rule. I said, if I'm at home, I won't drink alcohol. But if you came over
Right.
or if we went out to dinner and people are having wine, I would. And so just by following that one rule, I went to almost like no alcohol because essentially I'm home cooking organic food every day.
Right.
So that was that was an easy one. And then I've talked about 100 people and told them that, and everybody's like, "Oh, I drank 3 times more in COVID,"
Wow.
and
Yeah, that was me.
just because of the stress. And interestingly, this is going to go on a while, so I encourage people to try to because it's interesting. A lot of people these outbreaks happen in and around bars, and so I think alcohol is a little bit of an issue,
Mm.
and it's a little challenging for people to do it. And for me, it was just really easy because I felt like it was part of this thing that I was doing because I knew I was going to get exposed to people. And
Yes.
so I had like a good reason. It became part of my mission statement.
Right.
And as soon as it became a part of my mission statement, the difficulty was like a 0 out of 10. It was so interesting.
Right.
So alcohol is one. And then there's a bunch of simple things that people can do, like take quercetin, it's an oral supplement, take zinc, take vitamin D, take vitamin C, just some simple immune boosting supplements. And there's
Right.
10 different flavors of how to do that. We're if someone is sick, we're starting everybody on a peptide called thymosin alpha 1, and people
Mm-hmm.
can call our office and get a cheap consult. Uh, and then we're prescribing that, and that helps to regulate your immune system and helps your white blood cells start to fight the infection. And
Okay.
it's a it's a bioidentical peptide to a peptide that's made by our thymus gland that helps your immune system make antibodies and fight viruses, and it helps your immune system just be more coherent.
Mm.
And there are some IVs that we do and that come from the European experience of integrative medicine called ozone therapy,
Oh,
where we take
yes.
blood out of the body and mix it with ozone, which is an oxidizing therapy. It seems to, we think it probably oxidizes the viruses and
Mm.
makes it so they're less able to fight us. And so we're doing all of that, and then we just submitted a randomized clinical trial to study exosomes for
What
COVID.
are what are exosomes?
Exosomes are stem cell secretions,
Oh, okay.
and and so you could think of a stem cell as kind of like a general contractor.
Mm-hmm.
If I bruised my shoulder, that would
Yes.
swelling. And
Right.
then what would happen is the stem cells would see that swelling and they would go in there. But this it's kind of like a general contractor that rolled up on a construction site. And then she's looking around and she goes, "Oh, there's some inflammation."
Yeah.
And so what they do in response to inflammation is they secrete little uh, balls of growth and healing factors that just turn inflammation off and reset and heal things.
That's
So
amazing.
yeah.
No, I mean, I've read a lot about stem cells. I believe that, I mean, isn't it just the beginning in terms of stem cells? We don't know. I mean, it's sort of like the beginning of the journey with stem cells, isn't it?
We're early in our experience of regenerative medicine with stem cells and exosomes, and the FDA over the next year or two is going to be weighing in on a lot of these factors. There's 5 or 6 or 7 different genres and types of stem cells.
Right.
They probably all have different profiles and ways that they heal. There's 5 or 6 or 7 kind of different categories of exosomes. They
Mm.
have different ways that they heal.
Okay.
And then there are thousands of peptides and all of these other factors. And so it's a constellation of, of thousands of all moving bubbles and data points that are all interacting with each other in complex and diverse ways.
Okay.
And so the concept is to have a sense of how all of those things work, and then to begin to do things and use them as tools to
Right.
start to hack physiology and
Okay.
optimize how that works.
Okay.
And my first sort of entree is always to do lower cost, simple things and start to see how they work, and then work my way through and do more complex, bigger things.
Oh, that's good. I like that approach, a more careful approach rather than just going full on. So I'm curious, in terms of how you treat your patients, and how you make them come alive. I mean, what are so there's stem cells, there's certain, like you said, IV, and then there's also certain drugs that are kind of in vogue right now, which are ketamine for depression. So could you talk to us a bit about sort of these alternative modes of helping depression and anxiety? I mean, I'm curious about that because a lot of people, especially right now, are curious about it.
On the depression front, what I try to do is I try to get a sense of, when did the depression first start? Did this just happen recently as a result of COVID times? Did this happen as part of a generational thing, or when you were a
Mm.
child? Often when we my Sifu used to, my Chinese medicine Sifu, Jerry Allen Johnson, used to always say, when was the first time you ever felt this way? And a lot of times people will come up with something that was terrible that happened to them when they were 5 or 10 or 15.
Yes.
And then, and so then what we do, and this is really important, it's a little bit kind of like what we were talking about at the beginning of the conversation.
Mm-hmm.
What's your mission statement? Who are you, and what's happening? Now,
Mm.
if your mission statement is that you're changing the universe and you're doing something and helping people find your purpose,
Yes.
and, or their purpose, and if that's what you're doing and something bad happened to you in that process, that's
Mm-hmm.
kind of seems like no big deal, because you're kind of a superhero who's overcoming challenges and doing things. And so then I try to find that storyline. I'll find that storyline for myself, and I'll often say, oh, I went through this, and then I got over it.
Mm-hmm.
And and which is super interesting. Um, and often people will start to tell me, oh yeah, I see, I'm actually going to be fine now. Like they'll connect the dots of their superhero story
Mm.
and begin to realize their purpose. Now, ketamine is interesting because ketamine turns some of the depression pathways off in the brain.
Right.
And then it also makes you feel really good, and it stimulates dopamine and serotonin. And so then imagine that we've just told a brand new story about how you're an amazing hero and you're going to totally transcend and overcome all of this stuff. And then we give you this drug, and it's interesting, you're super like hypnotizable under ketamine. And so what I do is I tell people, you're going to be super hypnotizable, but you're going to hypnotize yourself. So we can put any program we want in here.
Oh, wow.
And so then what happens is we focus and kind of start to write and craft a story about how you're going to overcome depression and heal.
Oh.
And then we'll do, and so it's sort of a spiritual reset. It's like maybe my favorite thing that I do with people, because I see people just transcend problems that bugged them for 20 or 30 or 40 or 50 years even.
That's incredible. So now are you doing this via telemedicine? Can you do this?
Yeah, so so one thing that you can do is we'll mail people like a lozenge of ketamine, and then they'll do it, and then we'll sit just like this talking to people. And so
Incredible.
we'll do that, which is interesting. But mostly people come into the office, and so then you can take a little shot in your muscle,
Mm-hmm.
or you can also do IVs. And the thing that we're sort of known for is we do a whole bunch of IV therapy that helps reset the mitochondria in your brain and helps them work more efficiently. And we have a stack of supplements in a specific order that we go through to begin to unlock the biochemistry and get your central nervous system physiology sort of super dialed in.
Right.
And when you put ketamine on that upgraded platform, it seems to work longer. Like, I just had somebody come see me who I had done my initial therapy,
Mm.
and uh, they were like, yeah, it worked, but wore off in 8 months. And then I was ketamine normally only lasts for 2 weeks. and
Wow.
and so is that was, and this was years ago, but that was like one of my real early signs. And so they just came back recently. And so what I'm experiencing is that we're doing sort of, my company is called BioReset Medical.
Yes.
And so the concept is that if we reset our physiology, we're like a different person. And
Mm.
so that often a reset can have a much longer lasting effect than just a simple drug would have.
Can you tell us a real success story from someone who came to you for a treatment and they were suffering from something, and then their life I mean, is there a life-changing story that you could tell us? Because I
Yeah.
love stories like that.
Oh, really? So I have this. It's actually this woman who, um, uh, it was. God, I got to figure out what. This family came to see me, and it was is this girl that just I just saw, and so I'm going to tell her to watch this. But so then it was it was a really sort of overwhelmingly difficult case of somebody that hadn't been out of a basement apartment in like a year.
Oh, wow.
And so uh, I went in and I said, I looked at the situation and I realized there was no way that I was going to be able to get to a point of like doing ketamine and having it be okay, because there was so much stress and there was so much like stuff going on.
Mm.
So I just said, you know what, I'm going to buy a vowel. Like,
Okay.
on the prices,
Yeah.
right? You got to buy
Yes.
a vowel.
Yes.
So I'm going to buy a vowel. And I don't know if I had ever told this on a podcast, but I had a kind of a VIP there who was waiting for a stem cell procedure. And I
Mm-hmm.
said, we got to cancel this next case, which was, and so, or delay it. And they didn't want to delay. So I canceled it and I stayed in there because this situation felt so sort of overwhelming. So then we talked and talked and talked and came to a realization that like there was hope. And
Mm.
in a way, that's what we're always trying to do, is find some sense that there was going to be hope. And so we kind of made it there. And we had this moment like everything was going to be okay. And we had this whole joke about we bought a vowel. And I said, in life, sometimes you just need to buy a vowel. So then they went to the hotel, and they were walked in and they had just like an incredible family evening, and no, they hadn't had that in years. And then they came back inside, and um, they walked inside into the hotel in the lobby, and they
Mm-hmm.
looked up. Price is Right was on, and there was a
Oh, you're
woman
kidding.
who had the same name as the woman that I saw,
Right.
and it flashed on the screen her name, and she said, I'd like to buy a vowel. And then she ended up winning $25,000. And
Wow.
that was like the sign to them that like, and the universe was talking to them. Kind of like, did you ever see that movie with Steve Martin, LA Story, when the traffic
Yes.
signs were talking to him? It was, I'm telling you, it was just like that. It was super crazy.
So
And
cool.
so then she came back and was basically like, I saw her last week, And she was like, I've been doing a lot of spiritual work and I know that I'm going to be okay. And now I'm here to pick up the pieces and kind of do some things, but like, I'm going to be okay. And then she brought me a Price is Right game board.
Wow. That's
That's from
incredible.
that thing. But it was
That's great.
it was interesting because I almost, regardless of all of the things, the ketamine I think was super helpful, and we did AD, we did all these things, but she had like a psychic realization that there was a pathway out. Like, I'd
Mhm.
like to buy a vowel, I'm going to solve the puzzle, and I'm going to be
Mhm.
okay.
Yeah.
And then that helped her begin to craft a story. And so then she's living in a beautiful apartment and has a full-time job and has a normal life now
Right.
and is working. And so it's kind of, and I think I probably relate more of that to just the fact that she was able to craft a new story. And so that's what we're trying to do. And so then ketamine is an interesting tool. There's hundreds of interesting tools, but
Mm.
it, the thing that I'm super optimistic
But
about for
wait,
all,
there's one thing about it that I don't want to forget to say, because a lot of people are taking this recreationally
oh
and
yeah,
they need to know that this is not something to toy with. So I don't want to not point this out in a very serious way, because I would love for you to go through the harmful effects of taking this in a
oh
recreational way.
so here's the thing. This is a good one. I always like to talk about dosage, and the
Mm,
reason I like to talk about dosage is because I'm an anesthesiologist.
yes.
So what happens in the recreational sort of experience of ketamine is people are doing it, but they have no idea how much is in there.
Right.
Okay. So imagine if I said to you, "Hey, we're gonna have some wine," and then you said, "Oh, great," and you said, "How much are we gonna have?" I go, "I don't know, somewhere between 1.5 and 3 bottles."
Mm, mm-hmm,
Okay.
yeah.
So
Right.
so then what would happen is all of those doses would be too much, and you probably have to lie down and just sleep it off.
Yes.
And it might actually be toxic and have all kinds of side effects. What happens is people with ketamine, they have no idea how much they're doing. And so they go into what's called a K hole.
Right.
And then when they do that, sometimes people will have to lie down. I mean, ketamine is a general anesthetic at
Mm,
high doses. And so what we're doing is what I would call a mini dose, and then there are some people who will use it as a micro dose and actually have some benefits. And so a mini dose would be 0.5 mg/kg. So like for someone, your dose might be like 20 or 25 milligrams
mm,
as an IM or an IV treatment. Um, for micro dosing, people are micro dosing like 1 or 2 milligrams, so very low dose that
okay.
seems to have antidepressant effects on the body.
Right.
But ketamine is a scheduled drug that should only be given by physician, and thoughtfully and carefully. And the people who we've seen the most benefit are people with drug resistant depression, people with addiction, people with PTSD, people with a lot of trauma in their background,
Mm,
and also with anxiety. And so then we'll use that. But I tend to like to do fairly self-limited uh, trials where I'll treat someone and we'll do a series of 5 or 6 and then take a couple months off, and then often maybe we'll do a series of, and we might even do it once a week. You
right.
know,
Yeah.
it's a
No,
recreational thing.
right. Well, I want to definitely clarify that, because I don't want people to all of a sudden like get ketamine and think they're going to not have depression. It's just something we have to, there's a disclaimer. There has to be when we're talking about
And
this.
and so that's for sure. And then I think this cultivating that storyline is as important as anything else.
Yes.
Um, so
Yes. Great. So in terms of, anti-aging, I mean, this is clearly, huge business, and we all do what we can do to stay young and fit and healthy. What can you do from a young age? I mean, it starts at a young age. I mean, it should. So what are some of the things that one can do to sort of stay as fit and as ageless as possible.
That is a good one. And so that's what we're doing, right? That's what we have to do. To basically, what I tell people is I'm trying to sort of like get maybe 1 year younger every year. Just kind of
Yes.
stay here. Now, on the aesthetic front, what that means is I'm we're doing like a lot of injections, like with peptides and
Mm.
other very safe things to inject in the face and hair to kind of keep collagen and keep connective tissue, and we're injecting growth factors into the face, for example, and all of those type of things, which is pretty interesting.
Wow.
Um,
So what does that look like? I've never heard that before. Can you just describe what that is?
so then what happens is uh, there's a bunch of different peptides that tend to be very anti-inflammatory.
Mm.
And so what we will do is we'll inject those in and around wrinkles and then
Okay.
in the face.
I
And
see.
for people, for example, that have like acne scarring and stuff like that. And we're improving the local health of the blood flow and the nerves in the area of the face. It's the same thing that I do if I'm treating your shoulder. I'm putting the same type of things in to heal the connective tissue and nerves that go to your shoulder.
Okay.
And so then now we're basically, my philosophy is, first of all, and when you went to longevity, for some reason I went to aesthetics, but in broad terms, my philosophy and what I believe is,
Mm.
number one, eliminate toxins, eat a super healthy diet, don't eat anything processed, eat 100% organic, don't ever eat artificial sweeteners, don't minimize sugar, and do intermittent fasting, and I eat minimal grains
What
and
about
organic.
gluten? No
Huh?
gluten. Gluten,
No,
no gluten.
no gluten. I tend to do minimal dairy. So then there's that whole lifestyle. And I think alcohol is probably great, but then it's what I found with almost everybody that I've ever met. I have like 3 or 4 friends who I really love, who are really unbelievably moderate, and they're able to have like 1 glass of wine a day.
Yes.
But for the most part, I've almost never met anybody else that's super good at that. And so what I find is never binging, and then at least taking like 3 or 4 or 5 days a week off. And I
Mm.
kind of like to at least take 5 days a week off. So then now you've got this moderate kind of theme going through diet, lifestyle, exercise. I like kind of a blend of high intensity interval. We do
Okay.
strength training and yoga. So
Okay.
then I think that's super important as a concept. Then doing all of that testing on ourselves and making sure their inflammatory levels aren't high, all of our labs are normal, tracking for cancer markers and doing all of that stuff, I think is super important. uh, from a biochemistry perspective, there's this new genre of medicine called peptide therapy.
Mm.
And so there's peptides that do everything that under God's green earth, essentially. There's peptides that regulate your immune system. We use those for COVID. There's peptides that help your hormone status. There's peptides that are anti-inflammatory, peptides for developing the brain. And
Mm.
so then we're constantly cycling through different strategies of of um, of modalities that turn on aspects of how our biochemistry works,
Right.
and then cycling through it. So just like when I do training, I'm cycling through training and creating muscle confusion so it doesn't know what's coming. We
Okay.
do the thing to biochemistry, so the biochemistry is never really sure what's happening, and so it keeps it dialed in an optimized way.
So does that mean that you're actually troubleshooting all of these different
Yeah,
ailments, many different things? When you say cycle through, that means you're hitting all of them.
yeah. So trying to do all of that, and then the next thing is there's a lot that we do with IV therapy, so IV vitamin C and different
Oh, well,
IV.
this is my question. Sorry, I'm interrupting, but for people, so IV vitamin C is great, love it. But what can people do if they don't have access to that? I mean, if they just walk into a pharmacy, what are the top 5 vitamins they should take?
So I'll give you the caveat that it's probably worth doing some testing to figure out,
Okay.
figure out so you can test some levels. But I would say I would take oral vitamin C, I would take vitamin D. Uh, right now, I would take quercetin and olive extract because those are anti-COVID. And I think the most important thing you can do is optimize your health and prevent COVID. And then maybe take zinc for immunity.
Okay.
So I would do those things regardless of all other things. I could talk to you for a year about, sexy expensive modalities,
Right.
yet a healthy diet, lifestyle, exercise. As I was talking to my dad, and he goes, well, seems like healthy exercise and diet is the most important thing. I go, yes it is.
Yes.
So,
And water.
oh yeah, and hydration, yeah. So that one's super interesting. I do 50-50 blend of spring water and reverse osmosis water.
Mm.
But then also, if you're going to do that, then get super dialed in about remineralizing the body. And so I drink 3 or 4 of these things called Quinton. It's
The keep.
basically
Yes.
French,
Right.
French,
Yes.
and it's super famous in France. And so
Yeah.
I get these glass ampules, and then I drink those every day for remineralization.
I just started drinking the keto drinks. I mean, I just got it at the pharmacy. So I don't think I don't know if it's very special, but it's good for my energy. I feel a bit better. Are we talking about 2 different things?
We're talking about 2 different things.
Ah,
There's these minerals that come from seawater that actually come from France that are named after this super famous doctor named Quinton. But then if I was gonna,
oh,
that's a Freudian slip. But if I was gonna say one thing that I
okay.
really love, it's ketone esters. And ketone
Okay.
esters, the ketones that you just mentioned,
Yes.
are super good. And they are actually a little bit of a source of fuel for your cells. And
Nice.
so that's why you can get a lot of energy from them. And often when I have people who are not metabolically flexible, and interestingly, if you could only do one thing, if I could only do one thing, and I wanted to get data around this in terms of longevity,
Uh-huh.
it probably would be managing blood sugar.
Oh, yes. I have low
Blood
blood
sugar.
sugar. Yes.
Oh, you do?
Oh, yeah.
Oh, okay. So what you're going to do is I can call a prescription in for you if you want one of these.
Oh,
And so
thank
you're
you.
going to get a patch that you put on, and then what your phone's going to be able to read your blood sugar. And so
Really?
you don't have to you don't have to do a finger prick. And so what will happen is then fast forward in your life, and then what happens is in the south of France, and you go to a nice dinner and you have a bunch of pasta. So
Right.
then what you're going to do is now you're going to check that. And then the next day you're going to be kind of keto and taking your ketone esters and stuff like that. And so then you're going to see, and then you're going to be able to build a map over, a couple weeks of what your blood sugar is and how you're doing with that. And then that's super valuable because now if you start to get some feedback, the my blood sugar has been going up to 150 every time I eat that meal, then now
Ah,
you eliminate that. And so then, and you build some strategies in, and there's going to be an enormous amount uh, of interest and work in this area. And the reason is because there's essentially trillions of dollars worldwide to be saved if we can prevent and eliminate type 2 diabetes. And,
wow.
and the way that we do that is by managing insulin and blood sugar. And we start by tracking, and then we do blood tests, and we start to look at the hormonal state with that. And so then, and what is that? That is basically our functional medicine conversation,
Wow.
because this is now one data point, but it may be like the most important data point.
Mm.
And so then now we begin to see and we go, oh, okay, well, your blood sugar is just a little bit high. It's not crazy high. And so then we start to focus on diet a little bit. And then there's some supplements that are helpful at harmonizing and stabilizing that, like berberine.
Burberry.
And yeah, it tastes delicious too. So then all of a sudden we start to layer that in. And now this is what we call personalized medicine, because maybe your blood sugar was up here and it starts to kind of harmonize down and stabilize, and you're able to track it super easy. And then often what I find is, which is just like the amazing thing about practicing medicine, if people come in and they say, oh yeah, by the way, something else totally crazy happened, this got better.
Wow. Right. So I would imagine you would be able to think more clearly once, I mean, there's so many things. You have more energy. You can think more. I mean, so many benefits to actually getting everything straight.
Yeah. And, there was a term that I don't think that I ever heard one time in my entire life growing up, but it's a term that I've heard basically every day for the last 10 years, which is brain fog.
Yes.
Like,
Oh, brain fog. Candida.
but yeah, so anything that causes inflammation anywhere in your body
Yeah.
is going to will lead to inflammation that somehow spills over into your bloodstream. Now, COVID does the same thing. And when inflammation spills over into your bloodstream, that inflammation begins to affect the brain, and it has a hard time doing what it's doing.
Yeah.
And then that's a difficulty concentration and stuff like that. And so then it's something that we see in 100% of people that have stealth infections. It's something that we see in 100% of people who have high blood sugar. And interestingly, they have a new name for dementia. Do you know what it is?
No.
Type 3 diabetes.
Really?
The idea is
Fascinating.
that high blood sugars lead to inflammation in nerves and stuff like that, and it leads to disease in the arteries that go to the heart, which is why people have heart attacks. But it also leads to disease in the blood vessels, and it actually leads to inflammation in the tissues of the brain.
Oh my gosh.
And so then, it's like the there was that old expression. And I'm a sucker. You've never met anybody that's a sucker for marketing like me. And I remember I used to walk around and I used to sing that song, I'd like to buy the world a Coke. And it's like, I'd like to not buy the world a Coke.
Yes.
I'd like to take that away, and I'd like to give them something else that's like super amazing and healthy.
Exactly.
And then there's literally millions of people who could have 10 or 20 years of amazing life without dementia,
Yeah.
if they could start now and begin to work on harmonizing and optimizing their biochemistry. And the thing, and I guess this is my mission, and this is what I believe, to go back to the beginning.
Mm-hmm.
What I believe is that people are going to begin to be empowered. And people are going to be vastly more empowered now than they were before, because everybody's been stuck at home. And so, like, I've got several programs that I'm coming out with that are programs. I've got a program for basically teaching people how to inject peptides themselves.
Really? Really?
Yeah, because right now I talk to somebody every day from somewhere around the world who says, I can't wait to see you, but I'm not going to see you for about a year because the airports and
right.
Kuwait are closed.
So this is great. So people can, this is great. Tell us more.
Yeah. So it turns out with peptides, if you have pain, if you have pain somewhere, you can just inject. I had some pain in my wrist this morning because I banged it yesterday. So then I just injected some BPC 157 in the area where it hurt, and then the pain went away.
Wow.
And so but then what happens is all of a sudden you begin to say, hey, I've got depression and anxiety for the last couple of months because I was coped up. But then what we're going to do is we're going to develop a strategy, and I'm going to get oriented to my mission statement in my life, and I'm going to overcome it.
Mm-hmm.
And so in all of these different ways, I feel like people are going to become progressively more empowered. And
Yes.
then as we get more empowered, we begin to harness our physiology and our biochemistry. And then once we do that, then, in anesthesia, this was a good one. It's hard. Generally, nothing goes that wrong in like 5 or 10 minutes.
Mm-hmm.
And anesthesia is like flying a plane. If you take off in San Francisco and you're going to Sacramento, it's pretty hard to get lost, because as soon as you get up in the air, you see Sacramento and you can land.
Right.
If you're 3 degrees off on your way to New York, you're going to end up in Atlanta.
Right.
If you start to harness your physiology now, you
Mm.
can prevent that dementia from happening.
Yes.
So the people who are listening to this, who are in their 50s and 60s, now is the time to act. Now is the time to take control of your life. And that's why I am talking about some of these things like alcohol and toxins
Yes.
and sugars and Diet Coke and stuff like that, that, I would have probably had, when I was in medical school or something like that. But now I realize if you take control and you eliminate all of these things, then what's going to happen is you may prevent the 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 disaster of your life, because you're able to track it. And
Mm-hmm.
there are simple things that you can do that cost almost nothing, like getting a blood sugar monitor, and um, and then starting to track that and starting to pay attention to other things. And there are a lot of very simple steps that people can take. And then once you start to take a little step and you start to feel better, you get super empowered to do more.
Mm.
So people like that, the woman that I mentioned, got a little bit better and all of a sudden got a job, and then got a little bit better and they got a better job, got a little bit better, got an apartment. And so then in this way, I believe that the human spirit is unrepressible, and that our ability to overcome anything is possible. And so then we just have to ask the right questions, and then learn to kind of biohack and solve the equations that are in our consciousness and in our physiology. And once we do that, then things start working. And if we're kind of connected and oriented to our true purpose,
Mm.
it's going to be perfect.
Wow.
We
So,
were talking offline about this idea of aging, and the idea, especially like when you're getting into your 50s and stuff like that.
yes.
What what's your sense for yourself on that?
Aging. Well, I believe that you can regenerate your cells yourself, because I'm a meditator. I'm a Vedic meditator. I've been meditating for about 6 years. And they say once you start meditating after 6 years, you do actually become younger. That's what they say. I don't know who they is, but I believe you can regenerate your cells. And if I really think, and if I feel it and think it, I feel that I become a more vibrant, younger looking person. So yes, you and I were both saying earlier that you said it, and I agree, that you can, reverse the aging clock yourself by simply feeling it and thinking it and knowing that you're getting younger.
Yeah, my I studied yoga for like 10 years with this person named Arkady Sharon. And I personally think he's the greatest yoga teacher like in the world. He was awesome. And it, every day that I was with him, he would say, the body is a self-healing organism.
Mm.
And so the body, that's interesting to repeat, the body is a self-healing organism.
Yes.
And so a nerve just sends electricity to a part of the body. So I'm just trying to reset that nerve so that the body can do a good job of being a self-healing organism. And then we do different therapies. Sometimes it's talking, sometimes it's, drugs, sometimes it's supplements, sometimes it's peptides, just to basically optimize and reset the body so that it can do its job, which is to be a self-healing organism. It's
Incredible.
kind of, and so then I believe that, and I believe it more and more every day. And so then I like this idea of and so the story that I'm telling myself is that every day I'm getting a little bit younger,
Mm.
just a
Yes.
little. And that takes you away from that existential feeling that um, maybe you're getting older and dying, right?
Yes.
And yet, getting older and dying, I'm kind of fine with too,
Yes.
because there's something kind of beautiful about that experience. Like I listen, and my favorite musician, I would say, is Bob Dylan. And his work over the last 20 years of exploring exploring aging, exploring death, and the image in his imagination and in our consciousness is so interesting. But regardless of that, I'm still telling myself this kind of happy-go-lucky story that's hopeful and aspirational to optimal health.
Mm.
And what I'm noticing is that it works, and that's why I think people who meditate, I also do, and I think when you do that, it works, and it helps calm down that kind of negative internal voice that is in all of our heads, and
Yes.
it helps us kind of just orient to awareness
Yes.
and the
I mean,
awareness of
absolutely. I mean, I'm having a full-on hot flash right now, but all I keep saying to myself is the body is a healing vessel, and I am young and I am getting younger every moment.
good.
Well, I'm going to end on that. I
That's
wanted to make you laugh.
No, I'm just thinking, what do we need to do to help you with that?
I know. Thank you, doctor. Wow, this is so great.